Welcome to our channel. In this video, we're going to discuss a condition that affects many women but is often misunderstood: adenomyosis. Adenomyosis is a chronic and often painful condition that involves the growth of endometrial tissue, which normally lines the uterus, into the muscular wall of the uterus itself. This can lead to a variety of symptoms and can significantly impact a woman's quality of life. Let's start with the basics. The uterus is made up of layers, including the endometrium, which is the innermost lining that thickens and sheds during the menstrual cycle. In adenomyosis, this endometrial tissue begins to grow into the myometrium, the muscle layer of the uterus. This results in an enlarged uterus, which can cause considerable pain and discomfort. Research indicates that adenomyosis might be more common than previously thought, with some estimates suggesting that up to 20% of women could have this condition, although many go undiagnosed. It typically occurs in women in their 30s and 40s, often those who have had children, but it can also develop in younger women. Now, let's discuss the symptoms of adenomyosis. Many women with this condition experience heavy menstrual bleeding, known as menorrhagia, painful periods, or dysmenorrhea, and we can't overlook the chronic pelvic pain that sometimes accompanies it. Other symptoms might include pain during intercourse, swelling or enlargement in the lower abdomen, and even issues that interfere with daily activities. It is important to note that the severity of the symptoms does not always correlate with the extent of adenomyosis. Some women may have very little tissue growth but severe symptoms, while others might have significant growth with minimal pain. Diagnosis of adenomyosis can be challenging. Doctors often use a combination of your medical history, a physical exam, and imaging tests, such as an ultrasound or MRI, to make a diagnosis. Unfortunately, due to the overlapping symptoms with other conditions, adenomyosis can sometimes be misdiagnosed or overlooked. Unlike some other gynecological conditions, the definitive diagnosis of adenomyosis can only be made through histological examination of the uterine tissue, typically after a hysterectomy. Once diagnosed, treatment options for adenomyosis can vary based on the severity of symptoms, the extent of the condition, and a woman's reproductive plans. For those with mild symptoms, management may involve over-the-counter pain relievers like ibuprofen. Hormonal therapies, such as birth control pills, hormonal IUDs, or other hormonal medications, can help regulate periods and reduce pain by decreasing or eliminating menstruation. In more severe cases, surgical options might be considered. For women who do not wish to maintain their fertility, a hysterectomy, which is the surgical removal of the uterus, may be the most effective long-term solution. However, it's essential to discuss all potential risks, benefits, and implications with a healthcare provider before deciding on surgery. Some women may also explore conservative surgical options, such as endometrial ablation or adenomyomectomy, which involves the removal of the affected tissue. Living with adenomyosis can be challenging, and it's important to have a strong support system. Many women find that lifestyle changes, such as regular exercise, maintaining a healthy diet, and practicing stress reduction techniques, can help manage their symptoms. Educating oneself about the condition, seeking support from healthcare providers, and connecting with others who have adenomyosis can also provide relief and understanding. In conclusion, adenomyosis is a complex condition that significantly impacts the lives of many women. Increasing awareness is vital, as is advocating for proper diagnosis and treatment. If you or someone you know is experiencing symptoms that could suggest adenomyosis, encourage them to consult a healthcare provider. Remember, it's essential to take charge of your health and seek the information and support you need. Thank you for watching this video on adenomyosis. If you found this information helpful, please consider subscribing to our channel for more educational content about women's health and wellness. Together, we can spread awareness and help women better understand their bodies.